my name is Catherine. I'm going to be the physician assistant student taking care of you today. Today we're going to be doing a cardiovascular and chest exam. Before we begin, I'm going to go wash my hands. In the meantime, you can take off your shirt, your shoes, and your socks. Okay, I'm making sure I have adequate exposure to the chest. I'm assessing the rate, the rhythm, and depth of respirations. I'm noting for any signs of respiratory distress or any use of accessory muscles during respiration. I'm going to check the chest configuration, ensuring that the anterior, posterior, and transverse diameter is at a ratio of 1 to 2. Okay, so now I'm going to ask you to face that wall and move your hair back. Okay. So now I'm going to palpate the posterior and the lateral chest walls for tenderness and deformities. Okay. I'm also going to be testing for thoracic expansion for symmetry of respirations. So I just want you to take a deep breath in and out. Wonderful. Okay, I'm going to now test tactile ephemeris. So I'm going to put my hands on different points on your back, and I just want you to say 99 slowly. Okay?
99, 99. 99, 99.
Okay, wonderful. So now for this, I just want you to cross your arms behind you, give yourself a hug, and move your hair a little bit. Okay, so now I'm going to percuss the posterior and the lateral chest wall, assessing for any resonance or dullness, and I'm going to compare the sides bilaterally. Gonna move the bra. Okay, so now I'm going to listen to your posterior and lateral chest wall. I'm going to listen for 1 full cycle of inspiration and expiration at each point, checking for any presence of rales, rhonchi, or wheezes, and I'm going to note any lung sounds that I hear. For this, I just want you to breathe out of your mouth. One more. All right, I heard vesicular lung sounds bilaterally. Okay, for this part, you can now lay down. All right, I'm now going to be palpating the anterior chest wall for any tenderness and deformities. Okay, I'm now going to be assessing the anterior chest walls, thoracic expansion for symmetry of respiration. So again, take a deep breath in and a deep breath out. Wonderful. Okay, same thing like the back. I'm going to do tactile ephemeris in different points. When you feel my hand on your skin, just say 99 slowly.
99, 99, 99.
Okay. Now we're going to percuss. So I'm going to percuss the anterior chest wall, noting for any signs of resonance or dullness at each point. And I'm going to compare the sides bilaterally. just lift up the bottom. Thank you. Okay. Now we're going to be listening to the anterior chest wall. I'm going to listen for one full cycle of inspiration and expiration at each point, listening for the presence of rales, rhonchi, and wheezes. For this, I just want you to breathe in and out of your mouth, okay? Alright, heard vestibular lung sounds bilaterally. So for now, we're going to move on to the cardiovascular exam. For this, I'm going to raise the head of the bed to about 30 degrees. Okay. Alright, so now I'm going to be observing the jugular veins for any signs of distension and pulsations. Okay. I'm going to use my stethoscope once again, and I'm going to listen for any bruise that I may hear. So for this test, I'm going to place the stethoscope on your carotid artery. I just want you to face the opposite direction and hold your breath, okay? And we're gonna do both sides. Okay, take a deep breath and hold it. Now other side, take a deep breath and hold it. Okay. So now I'm going to palpate the carotid arteries, checking for the rate, the rhythm, and the amplitude on each side. Other side. Okay. So now I'm going to use additional lighting to check the precordium for any signs of abnormal wall movement and the apical impulse on either side. Okay. So now I'm going to move on to palpating the anterior chest. I'm going to use the ball of my hand and place it around different parts of your chest. I'm going to check for the thrills, heaves, and lifts. Okay? So moving it over the aortic area, pulmonic area, Erb's point, move your brow down a little bit, your tricuspid point, and now mitral point. And while I'm here, I'm going to check the maximal apical impulse. I'm going to note the location, the size, and the intensity. I'm going to use 3 fingers, feel like a light tap, and then I'm going to move down to 1 finger. Okay, wonderful. All right, moving on. I'm going to, again, listen to your chest. I'm going to listen for the intensity of S1 and S2. I'm also going to see if I hear any S3, S4 sounds, for any murmurs, gallops, or rubs. Okay? So for this, I'm also going to palpate the carotid artery while I move my stethoscope on different points. I'm going to use my diaphragm first. Okay. Okay. Moving on to the bell, same thing. Okay, so now we're going to move on to the peripheral vascular exam. So for this part, I'm going to observe the upper and the lower extremities for any signs of symmetry, edema, pallor, or cyanosis. While I'm here, I'm going to test capillary refill of the upper and the lower extremities, ensuring that cap refill refills in less than 2 seconds. And I'll make sure to test without nail polish. Okay, lower extremity now. Okay, beautiful. Now I'm going to palpate your epitrophial lymph nodes. I'm seeing if there's any enlargement or tenderness. I'm going to do it bilaterally as well. Okay, other arm. Okay. Now I'm also going to test the same thing for the inguinal lymph nodes. So for this, I'm testing for the enlargement and the tenderness. I'm checking the horizontal chain first, and now the vertical chain. Okay. Moving on, I'm going to palpate a few different pulses on your body, checking the rate, the rhythm, the amplitude, and for symmetry. Okay. I'm going to start on the brachial artery, and I'm going to move bilaterally. The brachial artery, okay. Brachial artery on the other arm, radial artery, okay. Moving down to femoral, again I would check underneath clothing. Okay. Now popliteal, just have your knee bent, and I'm going to push deep inside of your knee to feel the pulse. So popliteal, now other leg, popliteal, you can rest. Now I'm going to check the posterior tibialis, okay. Posterior tibialis on the other side, okay. Dorsalis pedis, and then dorsalis pedis. Okay, so now I'm going to do the abdominal area. So I'm going to use my stethoscope and listen for any signs of bruise on the abdominal area. I'm going to move it on different points and name them as I go. Okay, so abdominal aorta, renal arteries on either side. Can you just pull down your shorts a little bit for me? Thank you. All right, iliac artery. Okay. And now femoral artery, I'll check underneath clothing. All right. All right, last thing is I'm going to palpate your abdominal aorta. So for this exam, I'm going to have to squeeze onto your stomach. And I'm palpating the abdominal aorta, checking to see if it's less than 3 centimeters. Okay.